Hello, my name is Dr. Stefan Toka from the Dentalklinik Dr. Toka in Sopron in Hungary. The patient, I created a three-dimensional planning video regarding your implant placement, which I would like to show you in the next moment. Also, you have received a treatment plan or approximate costs of the treatment plan in an email through our correspondent in the UK. So let me show you what I have planned at the moment. Okay, what we created here is a 3D plan of your lower jaw. I'm going to concentrate on the lower jaw because I saw that you have a lot more problems in the lower jaw than in the upper jaw. Since in the upper jaw I couldn't find any teeth missing, although I must say that cavities are not really visible in the computer tomography, so we might have to check on that when you're here personally. But regarding your lower jaw, what we can see here is a 3D model. You can see your teeth here in the front, and you can also see a gap here on your left side. And you can see that I have marked one tooth here, which is a little bit in a tilted position in red. Because of the position and the proximity to this large bone defect, which you have here on the right side, on the left side, it has a very bad prognosis, this tooth. I'm guessing this tooth removal is not that long ago, and you had quite a bit of an inflammation here. It might even be that the tooth was very hard to remove. There are many possibilities, but what we can see now is that you have a very large bone defect. If we compare it to the other side, you can see the bone is quite smooth and even. On this side, you have quite a defect. So what options do we have in order to extend the number of teeth on your right side and even to close the gap on the left side? One of the best options in your case will be the placement of implants. Implants are little titanium screws which are placed on the inside of a bone. Let me just make some adjustment so you can see it better. Yeah, it's little titanium screws. These are red in this case, but in truth they are gray. They are placed inside the bone. We drill a little hole inside the bone, place the implant, and the implant is left to heal inside the bone for a couple of months. During this time, during this healing period, you will not get any crowns on the implants for 2 to 4 months approximately, but we leave the implants under the gingiva, under the bone, the level of bone inside your mouth, and only after the healing time you come back until we open up a little flap on your gingiva of your or your gum, to say the right word. And we take some prints, and after 1 week after taking the prints, we create the crowns, which are then placed on the implant. So for your right side, just regarding your right side, it will be implant placement, and after that we're going to wait for approximately 2 to 4 months. Then you come back, we take prints, and 1 week after we took the prints, we can place the crowns on the implants. Okay, on the other side, where we have the bone defect, you can see that if we want to place an implant, a lot of the implant will be positioned inside the bone defect. This means that the implant is not covered in bone entirely, but most of the implant will just simply be inside this defect, and it will not have a good stability from the beginning. This means that my recommendation would be, first of all, we have to remove this one tooth here, which has a very bad prognosis. I don't think that this tooth is going to last more than maybe 1, 2, 3, 4 years, and after that you're going to need to have another treatment just because of this one tooth. So I would recommend we remove this one tooth and then concentrate on the defect we have now. I would recommend that we place 2 implants in these positions, 1 implant in the position where you used to have that last tooth we just removed, and 1 inside the defect. But we will have to do a so-called bone augmentation. Bone augmentation means that we use artificial bone to fill the gap. Yeah, this is how it's going to look like. And this artificial bone is going to transform into your own bone after a couple of months. Yeah, the transformation in this area, because of the size of the defect, will last approximately 6 months. In the best case, we can place the implant and the bone augmentation at the same time, and the chances are very good, but I have to see it locally inside your mouth. I can't really see it right now. I would say the chances are 80% that we can place the implants and the bone augmentation at the same time, since you seem to have enough bone further down below the defect on which we can place one part of the implant, and the other part will be covered with artificial bone, and the bone is going to form around the implant during that time. During that time, you won't have any teeth on this side. Unfortunately, we cannot make a bridge or anything else, or a removable denture, because it would apply pressure on the artificial bone from the top, and we don't want that. Yeah, it can be that the healing will be disturbed. Okay, so we can make fixed teeth on both sides in the lower jaw in your case, quite easily on your right side, but on the left side we will have to do a bone augmentation. My recommendation would be that when you come to us, we're going to place all the 4 implants and do the bone augmentation. Okay, we're going to have some stitches which will be removed approximately 1 week or 10 days after the operation, which can either be done here with us, or it can be done in the UK as well with a dentist or your practitioning doctor. And then I would recommend we wait 6 months. Even when the other side is healed in already, I would recommend we wait all the 6 months for all the implants to heal, and after 6 months you come back, we take the prints, and 1 week after we took the prints, we can place the crowns on top of the implants. Now, I still have to see what kind of shape your other teeth are in. If they need maybe crowns or any fillings or whatsoever, we have to discuss that in a personal when you come to us and we see each other personally, because in the computer tomography I can just guess. I can't really tell you what else should be done. But I think the main problem here is the gaps which you have, and closing that with implants would be the best option for you if you don't want to have any removable dentures. Obviously, we can also make some removable dentures, which would be much cheaper, but then again, you have removable dentures, which is not quite as stable and not as aesthetically not quite as pleasing as having implants. Okay, if you have any more questions, you can just write us an email to Kathleen or directly to us, and I will be happy to answer any questions. Thank you very much for listening.